I am all for patients having information and knowing what to search before they come and see their doctor, knowing what they want to think about in terms of implant choice. So there are a couple of things about that post that I noticed that I thought were perhaps not so helpful. One is 445 cc's in a very slender, petite woman is a really quite large implant size. That of course has effects in later life because the weight of the implant can affect the way the breasts appear over time. And then the half under the muscle, so that can be a good choice in very slim women, but you've got to remember that's called the dual plane technique, by the way. It's been long established by a chap called Tebbets many years ago, and it's good in some women, particularly after implant exchange. But what you have to remember is that it means that the implant is partly under the pectoralis muscle, and that's not an anatomic position for an implant to be, and therefore you can also get muscle twitch, particularly in young fit women. So that's called a dynamic deformity. And the other thing is that the pectoralis muscle holds the implant where it is. So over time, as the breast tissue descends, which happens naturally, you can get what's called a waterfall deformity, where the breast tissue falls off the implant. But these are all technical considerations which you and your plastic surgeon need to discuss. So it's not one size fits all. So I think Kylie's, maybe needs to put that message out there as well.